Here's what most people get wrong about lowering blood pressure after 60. They assume the answer is walking. 30 minutes a day, 10,000 steps, get the heart rate up. And for decades, that was the standard advice. But in 2023, a large pooled analysis published in the British Journal of Sports Medicine combined the results of hundreds of randomized trials and compared every major form of exercise by how much it actually lowered blood pressure. Walking did not come out on top. Jogging did not come out on top. Lifting weights did not come out on top. The category associated with among the largest average drops in systolic pressure, in the neighborhood of 8 millimeters of mercury, was a type of exercise that most people over 60 have never been shown, that requires no gym, no equipment, and no standing up. You can do all three of the exercises I'm going to show you today from a kitchen chair, from a recliner, even from a wheelchair. If your knees, your hips, or your balance have quietly taken walking off the table, this video was made for you. Now, 8 millimeters of mercury may not sound dramatic, but for context, that is in the same neighborhood as what some single blood pressure medications achieve. And researchers estimate that a sustained drop of just 5 millimeters of mercury may reduce the risk of major cardiovascular events by around 10%. So this is not a small thing. In the next few minutes, I'm going to walk you through exactly what these three seated exercises are, the precise numbers that make them work, the number of weeks the research says you should expect before your readings may start to move, and, this is important, the one mistake people make while doing these exercises that can temporarily spike blood pressure instead of lowering it. I see that mistake constantly, and I'll show you exactly how to avoid it. There is also one strange finding buried in this research, something about what happens to the arm you don't exercise, that tells you everything about why this works. I'll get to that near the end, because it surprised even the researchers. Here is exactly what this video will give you, in order. First, the 2-minute hand squeeze, the single most studied of these exercises, including the exact grip strength percentage, about 30% of your maximum, that the trials used, and a simple rolled towel trick so you can hit that number without buying any equipment. Second, the seated leg hold, which brings your largest muscle group, the thigh, into the same protocol, and the specific hold times that mirror what was tested. Third, the 6 breath per minute pattern, a slow breathing method built into a class of paced breathing devices that are FDA cleared, meaning cleared for marketing, not approved as a blood pressure cure, and the exact count you'll use, 4 seconds in, 6 seconds out. Fourth, the breath-holding mistake that can push a systolic reading up by 20, 30, or more millimeters of mercury mid-exercise, and the one-word cue that prevents it. And fifth, the realistic timeline, because the trials didn't run for a week, they ran for 8 to 12 weeks, and I want you to know exactly what to expect at week 2, week 4, and week 8. So you don't quit right before the numbers move. I'm a physician, and this channel exists to do one thing: take real cardiovascular research, the actual trials and guidelines, and translate them into plain language routines for adults over 60. Everything today is anchored to published studies I'll name as we go. And one thing up front, this is education, not personal medical advice. If you take blood pressure medication, especially beta blockers, talk with your own doctor before starting any new exercise routine, seated or not. Let me tell you about Frank. Frank is a composite of a very common patient story, so the details are illustrative, but the pattern is one that cardiologists and family doctors see every single week. Frank is 68. He lives outside Dayton, Ohio, retired machinist. At his annual physical in January, his blood pressure read 148/91. His doctor said what doctors usually say: "We'd like to see that come down. Let's start with lifestyle. Get some exercise, walk 30 minutes a day, and we'll recheck in 3 months." Frank nodded. Frank meant it. But Frank has osteoarthritis in both knees, the left one worse than the right, and by the end of a 15-minute walk, his knee is throbbing, and he's planning his route around places to sit down. He tried for 2 weeks. He walked a total of 6 times. Then February in Ohio did what February in Ohio does, and the sidewalks iced over, and that was the end of it. When Frank came back in April, his pressure was 151/92, slightly worse. And here's the part that matters. Frank felt like he had failed. He told his doctor he just couldn't do the exercise part, and he said it with genuine shame, like a man confessing he hadn't done his homework. But Frank hadn't failed. The advice had failed Frank. He'd been handed a prescription his knees could not fill, and nobody had told him that the exercise category with the strongest blood pressure evidence in that 2023 analysis doesn't involve walking at all. Nobody told him it could be done sitting in the recliner he watches Jeopardy in. Nobody told him the main tool could be a rolled-up hand towel. Frank's situation, some combination of arthritis, balance worries, neuropathy in the feet, a hip that never healed quite right, fatigue, or simply an Ohio winter, describes an enormous share of adults over 65. By some estimates, more than a third of adults in that age group report mobility limitations that make sustained walking difficult. If that's you, I want you to hear this clearly. You have not run out of options. You may, in fact, have been steered past the most effective option this whole time. So why would squeezing something with your hand, while sitting perfectly still, lower blood pressure? It sounds almost too passive to work, so let me give you the mechanism, because once you understand it, you'll never forget it. Forget the old garden hose analogy for a moment. I want you to picture your circulatory system like a town's water system. There's a water tower, that's your heart generating pressure, and there's a network of pipes running to every house. Those are your arteries. The pressure at any faucet in town depends on 2 things: how hard the tower pushes and how wide and flexible the pipes are. When we're young, our pipes are wide, elastic, responsive. They can relax and open up when demand changes. As we age, and especially with years of high pressure, the pipe walls stiffen and the inner lining, a 1-cell thick layer called the endothelium, gets lazy about producing a molecule called nitric oxide. Nitric oxide is the chemical signal that tells an artery to relax and widen. Less nitric oxide, narrower, stiffer pipes, higher pressure at every faucet in town. Now here's what isometric exercise does. And isometric just means you tense a muscle and hold it still, no movement. When you squeeze your hand at about 30% of your maximum strength and hold it for 2 minutes, the tensed muscle compresses the blood vessels running through it. Flow through that section of pipe drops. Then you let go, and blood comes rushing back through those vessels, and that rush of flow drags along the inner lining of the artery. That dragging sensation, researchers call it shear stress, is precisely the signal that wakes the endothelium up and tells it to produce nitric oxide. Do that on a schedule, 3 times a week for weeks on end. And the studies suggest the lining doesn't just respond in the moment, it appears to remodel. It gets better at its job. The pipes, all over town, become more willing to relax. That is why in that British Journal of Sports Medicine pooled analysis, isometric training was associated with an average systolic drop of roughly 8 millimeters of mercury and a diastolic drop of around 4, numbers that in their analysis edged out aerobic exercise, resistance training, and high-intensity intervals. Remember Frank, sitting in his recliner feeling like a failure because he couldn't log miles? The mechanism his arteries needed never required miles. It required 2 minutes of squeezing, a release, and repetition. The signal is chemical, not cardio. And that's also your first clue about the strange finding I mentioned at the start, the one about the arm you don't train. Hold that thought, because it's coming. And Frank is far from the only one this fits. The 74-year-old who's afraid of falling after a wrist fracture. The 71-year-old in a wheelchair after a hip reconstruction. The 63-year-old bookkeeper who can't find a 30-minute walking window. Different bodies, different obstacles, and every one of them can do this entire protocol seated, back supported, feet planted. Zero fall risk. And here's the thing all of them need to hear first. Choosing the seated version is not settling for less. In the head-to-head research rankings, they may actually be choosing more. All right, here is exactly what to do in order with the numbers. Exercise 1, the isometric hand grip squeeze. This is the most studied of the three, the workhorse of those trials. The protocol used in most of the research is this. Squeeze at about 30% of your maximum grip strength. Hold that squeeze steady for 2 minutes, rest for 1 to 3 minutes, and repeat until you've done 4 total squeezes, alternating hands each round. That whole session takes 11 to 15 minutes, done 3 days a week. Now 30% is the number people trip on, so here's how to find it without any gadget. Take a hand towel, roll it into a tight cylinder about the thickness of a soup can. First, squeeze it once as hard as you comfortably can for 2 or 3 seconds. That's your 100%. Now relax and squeeze at what feels like a third of that effort. The test is simple. At the right intensity, you should feel firm, noticeable tension in your forearm, but you should be able to hold it for 2 full minutes without shaking, without gritting your teeth, and critically, while breathing normally and even talking. If you couldn't read a sentence out loud during the hold, you're squeezing too hard. 30% feels almost disappointingly easy for the first 90 seconds. The last 30 seconds, your forearm will let you know it's working. If you'd rather use equipment, inexpensive hand grip dynamometers exist, but the trial's benefit came from the tension and the timing, not the toy. Exercise 2, the seated leg hold. Sit toward the front half of a sturdy chair, back straight, hands resting on your thighs. Extend one leg until it's straight out in front of you, knee level with the hip or slightly below, and tighten the thigh muscle firmly, again at that comfortable 1/3 effort, and hold for 30 seconds while breathing normally. Lower it, rest 30 seconds, and switch legs. Work up to 4 holds per leg. If a straight leg bothers your knee, like Frank's, keep the foot on the floor and simply tighten the thigh as if you were about to stand. Hold 30 seconds. Same effect on the muscle. No joint movement at all. The thigh is the largest muscle group in your body, which means when those vessels compress and release, the flow signal we talked about, that shear stress waking up the artery lining, happens across a much bigger stretch of pipe. Exercise 3. Paced breathing at 6 breaths per minute. This one surprises people, but slow breathing has its own evidence trail. A 2013 American Heart Association scientific statement on alternative approaches to lowering blood pressure reviewed device-guided slow breathing, and there's a class of paced breathing devices built around exactly this pattern that are FDA cleared. And to be precise about that, cleared means the FDA allowed them to be marketed. It does not mean the FDA approved them as a cure for high blood pressure. The statement concluded the method may produce modest reductions for many people. You don't need any device to practice the pattern. Sit back, shoulders loose, one hand on your belly. Breathe in through your nose for a count of 4, feeling the belly rise. Then out slowly through pursed lips for a count of 6. 4 in, 6 out. That's 1 breath every 10 seconds. 6 breaths per minute. Do that for 5 minutes. What you're doing physiologically is stimulating the vagus nerve and dialing down sympathetic tone. In plain language, you are manually turning down the body's pressure-raising alarm system. Many people watch their home monitor read 5 to 10 points lower immediately after a session. And while that acute dip is temporary, practicing daily is where the studies looked for lasting effect. Put together, here's the weekly shape. Monday, Wednesday, Friday, do the hand grips and the leg holds, about 15 minutes total, in front of the television if you like. The breathing, do 5 minutes every day. Many people like it in the evening because it also helps with sleep. That is the entire program. 15 minutes 3 days a week plus 5 quiet minutes daily. Now the mistake, the one I flagged at the very beginning, because it genuinely matters for safety. It's breath holding. There is a reflex called the Valsalva maneuver, and it's what nearly everyone instinctively does when they tense a muscle. They take a breath, seal it in, and bear down. Watch anyone open a stubborn jar lid. That sealed breath spikes the pressure inside your chest, and during the strain, blood pressure can transiently jump by 20, 30, in harder efforts even more millimeters of mercury. For a young person, that's a blip. For someone over 60 with pressure that's already elevated, it's a spike we'd rather not repeat 40 times a week, and it's the exact opposite of what these exercises are for. The fix is a single word, and I want it playing in your head during every hold. Talk. If you can speak during the squeeze, you cannot be holding your breath. The two are physically incompatible. So during every 2-minute grip and every 30-second leg hold, count out loud softly, or hum, or narrate the television to your spouse. It feels a little silly. It is also the difference between a session that lowers pressure and a session that yo-yos it. And one more safety note, hedge the way it should be. These intensities are gentle, but if you have uncontrolled pressure above 180, a recent cardiac event, or an aneurysm history, get your doctor's explicit go-ahead first. That's not legal boilerplate, that's just how this is done properly. Now the finding I promised you, the one about the untrained arm, because this is the advanced insight that ties the whole mechanism together. In several of the hand grip studies, researchers measured artery function not just in the arm doing the squeezing, but in the opposite arm, the one that did nothing. And the artery function in the untrained arm improved too. Think about what that means. If the benefit were purely local, just the squeezed muscles plumbing adapting, the lazy arm should have shown nothing. Instead, the improvement showed up system-wide, which suggests the nitric oxide signaling and the calming of overall vascular tone travel through the entire network. The whole town's pipes respond, not just the one street you worked on. Practically, that's why a protocol as small as 4 hand squeezes can be associated with a full body pressure change. And it's also why you shouldn't fall into the more is better trap. The trials that produced that roughly 8-point drop used modest doses, 3 sessions a week, and there's no evidence that squeezing harder, longer, or daily multiplies the benefit, while it does multiply forearm soreness and the temptation to strain and breath hold. Stick to the studied dose. Who should skip this bonus enthusiasm entirely and stay conservative? Anyone with severe uncontrolled hypertension, anyone recently hospitalized for cardiac reasons, and anyone whose doctor has restricted exertion. For you, the breathing exercise alone is the starting conversation to have at your next appointment. Let's talk timeline, promise 5. Because expectations are where most people quietly give up. Week 1 and 2, expect to feel exactly nothing, except mild forearm fatigue and from the breathing, often better sleep and a small immediate dip on the monitor right after each session that fades within hours. That's normal. The artery lining remodels slowly, the way skin calluses slowly. Weeks 3 and 4, this is where some trial participants began showing measurable movement, often a few millimeters of mercury on the systolic side. Weeks 8 through 12, this is the window where the full studied effect, that average of roughly 8/4, showed up in the pooled data. Notice the word average. Some people responded more, some less, and people starting with higher readings often saw larger drops. So here's how to track it honestly. Use a validated upper arm cuff. Measure at the same time each morning, seated, back supported, feet flat, after 5 quiet minutes. No coffee in the previous half hour. Take 2 readings a minute apart and log the average. Judge nothing week to week. Pressure bounces around naturally. Compare week 1's average to week 8's average. And if you're on medication, absolutely do not adjust anything yourself. If your numbers come down, that's a conversation for your doctor. And frankly, it's one of the more satisfying conversations a patient can walk in with. Picture Frank at his next recheck, not apologizing this time, but sliding a little notebook across the desk. 8 weeks of morning readings, the last 2 weeks averaging 139/86, down from 151/92, and explaining to his own doctor what a towel and a Jeopardy habit can apparently do. Composite or not, that appointment happens in real clinics, and there's no reason yours can't be one of them. So let's put the whole thing in one place. The exercise category with among the strongest blood pressure results in that large 2023 pooled analysis is one you do sitting down. The program is 3 seated exercises: the 2-minute towel squeeze at 30% effort, 4 rounds, the 30-second leg hold, 4 rounds per leg, and 5 minutes of 4 in, 6 out breathing. 15 minutes, 3 days a week, breathing daily. Talk through every hold so you never strain, and give it 8 honest weeks with a morning log before you judge it. This is educational information, not a substitute for your own physician, but it is a plan your knees, your hips, and your balance can finally say yes to. If someone you love has been told to exercise for their pressure and quietly can't, a spouse with a bad hip, a parent who's afraid of falling, this is exactly the kind of video to watch together this week. Because the barrier was never willpower, it was the wrong prescription. If this was useful, a like genuinely helps this reach more people over 60 who've been told walking is their only option. And if you subscribe, you'll catch the next video, where we look at what your blood pressure numbers should actually be at 70, because the target you were given at 40 probably isn't it. I'll see you in the next one.